Thank you so much for joining us tonight for this educational webinar with our Fellowship Director, Dr. Kevin Spellman, and MMI faculty, Dr. Mary Bove. Tonight we highlight the Fellowship in Botanical Medicine and how to expand your therapeutic toolbox. We will also highlight our upcoming Fellowship Module 7, Botanical Medicine in the Treatment of Pediatric Conditions, Fellowship Module 5, Botanical Medicine in the Treatment of Female and Male Health. Dr. Spellman is an internationally recognized expert on the molecular biology and clinical therapeutics of botanical medicine. A past National Institute of Health postdoctoral fellow and Marie Curie Research Fellow in the European Union, Dr. Spellman has published 27 scientific papers and 6 chapters. He is an adjunct assistant professor at Massachusetts College of Pharmacy and Health Sciences, an adjunct professor of botanical medicine at National College of Natural Medicine, and a distinguished lecturer at Maryland University of Integrative Health. Dr. Mary Bove obtained her doctorate of naturopathic medicine and midwifery certification from Bastyr College of Natural Health Sciences and received her diploma of phytotherapy herbal medicine at the School of Phytotherapy in Great Britain. Dr. Bove practiced naturopathic family medicine and midwifery at the Brattleboro Naturopathic Clinic for 25 years, specializing in naturopathic pediatrics and botanical medicine. Once a full-time faculty member at Bastyr University, Dr. Bove chaired the departments of botanical medicine and naturopathic midwifery. Dr. Bove is the author of the Encyclopedia of Natural Healing for Children and Infants and is considered an authoritative reference on natural pediatric medicine. Dr. Spellman and Dr. Bove, I will turn over the webinar to you.
Thank you, Lindsay.
Dr. Spellman, if you can go through the fellowship overview.
Yeah, sure. Apologies, I just realized my phone was on mute. So thanks so much, Lindsay, for having us here. And I just want to say it's really great to have Dr. Bove as well. And I'm really thrilled to have you, Dr. Bove. You're clearly an expert in clinical medicine and botanical medicine and midwifery, and it's just a great addition to the fellowship in botanical medicine. So thanks so much for being here.
Thank you.
So as Lindsay said, we've got a number of fellowships here. We've done a couple of them already. One is built on the other, but they also stand alone. So the Intro to Botanical Medicines was done on Module 1. And Lindsay, is that available online yet, or is what's happening there?
Yes, Botanical Module number 1 is available online, yes.
Great, that's good to know, because that gives you a nice foundation. And then we've gone on with Dr. Christopher Hobbs, and we did the treatment of infections with botanical medicine, and that actually went really well. And we've got treatment of metabolic disorders and treatment of central nervous system and mood disorders coming up soon. I think one of those is in December, metabolic disorders in December, Lindsay?
Yes, it is.
Great. And then we've got the treatment of pediatric conditions coming up, and that's with Dr. Bove. And before you take that over, Dr. Bove, with just 2 more to mention here is Dr. Bove will also be joining me for the treatment of female and male health, botanical medicine treatment, that is, and then also we'll do restorative medicine at some point here in the future. We haven't got that pinned down yet, but it's coming soon. So Mary, you want to take it away and tell us a little bit about the pediatric botanical medicine module?
Absolutely. So the pediatric botanical medicine is focusing on cultivating health in our youth, which really looks at, using botanical medicine in a variety of different ways and capacities. First of all, many people wonder why would we try herbal medicines with kids? And just to point out some of the realities is that, one, the United States is the largest consumer of ADHD medications in the world. And there are a lot of great botanical medicines and good research on botanical medicines and the use of ADHD that avoids the harmful side effects of some of these medicines that are used for ADHD. And by using botanical medicines, you can not only avoid that, but be able to target many of the types of symptoms or issues that come up for children who are dealing with ADHD. Secondly, pediatric prescriptions for antidepressants have risen dramatically. And again, this is another place in which botanical medicine offers a wonderful alternative for mood disorders and for dealing with the ups and downs that might come with that. And there are many, many parents who really want to try to avoid using prescription drugs for their children, and this gives them another viable option for mild to moderate depression issues with kids. And then again, the reality is that, drugs are recalled all the time because of issues, and that there are 43 different childhood and infant formulas that were recalled in 2010 alone. And, using these kinds of medications have a purpose and a time, and if there are alternatives to be able to cut down the use of this or to offer an alternative, again, botanical medicine may play that part. And so we're going to be looking at herbal medicines that can be used for dealing with and helping ADHD kids, for mood issues, anxiety, as well as depression, and trying to avoid the use of many over-the-counter and or prescription drugs, and particularly something like Benadryl, which we know is really not a drug for children. That both national and international surveys show that herbal medicine is used in children is on the rise, and that there's an estimated 28 to 40% of children using herbal preparations to manage things like asthma, anxiety, ADHD, insomnia, and of course respiratory infections, because that's a high issue for children, because that's the nature of the types of infections kids get. So we'll be looking at ways that you can use herbal medicines to manage something like asthma and helping to improve overall health, to act as prevention, and to deal with asthmatic response in an acute situation as well. Next slide, Lindsay. So, how might you use it? And one of the things about the module is we're going to really look at all the different ways and capacities to be able to use botanical medicine, finding that they offer nutritional aspects as functional foods. Then they can be integrated into culinary, and that helps with prevention and building health and strengthen the microbiome, which can really make a big difference in the overall health of the child. Beverages can be a source of that, whether you're using herbal tea punches or you're using straight herbal teas or mixtures within that. They can offer alternatives to things like sodas, and again, offer good health supporting actions. And then nutritionally, that there are many herbs that provide not only vitamins and minerals, but other types of nutritional substances like polyphenols that are very important for good health, antioxidant, helping to cultivate the microbiome in the gut, those types of things. And then, of course, medicinally. And if we're looking at herbal medicines medicinally, to be able to see that we can use them in prevention, certainly that can be used at a variety of different aspects, whether we're doing tonification or we're trying to diminish allergic response. You can use them for symptom relief, and that can be, simply something to do with pain or inflammation, or something as simple as a bug bite or a bee sting. And there's a herbal medicine right there in the kitchen for people who have bug bites and bee stings. So you can put on a nice thin slice of white potato right onto a bug bite or a bee sting, and it takes it out right away. So looking at some of the first aid and simple remedies that are there in the kitchen that you can share with your parents of your kids. And lastly, therapeutics. Those children who are dealing with, a frank illness or a frank diagnosis such as ADHD, and looking at the application of herbal medicines to focus on the variety of aspects that could be involved in the therapeutic needs of such a condition. And with something like ADHD, you're looking at focus and cognitive function. You'll also look at detoxification of heavy metals and overall gut health, because we know that the microbiome has a lot to do with our psychological health and our learning ability and development and learning within children. So, it should be a great day of or 2 days of botanical medicine applied to pediatrics, and looking at all of the vast variety of ways in which we can, offer botanical medicines to children. And thank you. I think we'll go to the next topic.
Well, thank you, Mary. It sounds great, and I just want to reiterate, Mary, in my opinion, is probably one of the most experienced clinicians in the United States, if not all the Western world, in regard to treating both women's health and pediatric conditions with herbal medicine. So we're bringing in somebody who is just top-notch, very skilled clinician, and so this will be nicely evidence-based as well as real practical and clinical for the docs and the healthcare providers that attend. Should we move on to the men's health, Lindsay?
Yes, absolutely. I just wanted to interrupt for one quick moment.
Yeah.
We are going to be doing a question and answer section at the end. So if everyone could please use their chat option for your questions, please enter them there and we will address them at the end of the webinar. And please continue, Dr. Spellman, with men's health.
Thanks. So this is also going to be, I think, a great and unique perspective on men's health, because we're definitely going to be talking about food. As Mary talked about, food is absolutely key, and not only in regard to the constituents that you get, the phytochemistry that you get from food plants and whatnot, but also in regard to effect on the microbiome. So that's really key there. But when we start talking about endocrine regulation, we also need to consider lifestyle. And of course, inflammation and behavior go hand in hand. And so we'll touch on this. And of course, sleep quality also can really set off inflammatory patterns as well, which, and then in turn can affect the hormonal milieu. So aromatase, an enzyme that's important for both males and females, and actually a CYP enzyme, a cytochrome P450 enzyme, can drastically alter its kinetics through inflammatory patterns and chronic inflammation and diseases. And then we'll also be talking about, for example, in terms of male endocrine regulation, the antioxidants and how antioxidants alone aren't actually enough to have the influence that we'd want in, for example, in some sort of inflammatory condition such as BPH or acute prostatitis or even prostate cancer. And really what we'll look at and we'll discuss is a transcription factor by the name of NRF2, which will upregulate the body's endogenous antioxidant system. And so when we just put antioxidants in, we're not necessarily getting an upregulation of NRF2, and so we really don't get the kind of impact we want. So we'll discuss this. And then, of course, metabolic syndrome is going to have a rather profound influence on male health and the endocrine environment. And when we talk about metabolic syndrome, we have to keep in mind that it's literally, by definition, an epidemic in the United States. We've got at least 30% of our population with metabolic syndrome right now, and I don't feel like we're doing a very good job handling it. Every clinician is seeing it and having to deal with sequela of metabolic syndrome. So we'll be talking about that as well, and of course, adiponectin is really key here in terms of metabolic syndrome and satiety, so that people don't overeat. And of course, there's very new research showing a downregulation of adiponectin and BPH as well as in prostate cancer. So we'll discuss that and discuss how we can modulate that in regard to diet as well as botanical agents. And then, of course, we'll talk about the adaptogens. And the adaptogens, by definition, are compounds that are non-toxic, but more importantly, they are compounds that can regulate or normalize a altered response. So, for example, a classic example is the corticoid response with cortisol. If it goes up, in other words, if you're stressed, adaptogens can help bring that down. And if you're actually in a state of, say, chronic fatigue syndrome or just exhaustion, cortisol can drop. And, of course, that's one of the reasons you don't feel well. And adaptogens can actually bring that up. So we'll talk about the adaptogens, and then, of course, cortisol is going to influence the endocrine system and our hormonal milieu. So that'll be very pertinent as well. And then we'll go on and we'll talk about, I mentioned prostate already, but we'll talk about BPH, acute prostatitis, and then botanicals and foods that are appropriate there. For example, the data on dairy and BPH and prostate cancer are not looking real good, and so we'll discuss that. And then we'll end the day talking about erectile dysfunction. And of course, there's a slew of botanicals that can potentially be useful here, depending on the etiology of the erectile dysfunction. So I think I'll stop there and hand it back to Mary and let her talk about women's health now.
Thank you, Kevin. It's interesting, Kevin's introduced, some of the agenda for looking at men's health, and given the fact that we're going to also be talking about women's health and wellness, and that involves the female endocrine system, we're going to find similar trends in thought about the application of adaptogen herbs to, the endocrine system as it deregulates. And we call, deregulation in the female endocrine system often leads to multiple poor functioning endocrine glands that lead towards all kinds of impacts within the lifestyle, but often not frank disease per se. And within the endocrine system, we have to look at the glycemic process and function, and dysglycemia is definitely an issue that comes up for influencing female hormone and endocrine regulation. Adrenal and thyroid and the HPA axis will all be looked at, because many of the issues that come up around the ovarian hormones and the change of hormones at menopause are impacted by the overall endocrine function and whether or not there is poor function in the system overall. When we look at specific botanical medicines, we'll break it down to menstruating women and look at things such as dysmenorrhea, amenorrhea, anovulation, and PMS, luteal phase deficiency, polycystic ovarian syndrome, and then, oh, sorry, the slide's just a little confused, but and in looking at that, we'll look at the different physiological and metabolic aspects that influence these conditions and how we address that with botanical medicine. And sometimes that is an array of several different aspects of looking at botanicals in the application. Then we'll also look at the perimenopausal and menopausal period of time. And there's a lot of good research on botanical medicines used for general menopausal symptoms, things such as insomnia. There's quite good research on valerian use in insomnia, hot flashes, anxiety. So we'll look at some of those botanical medicines that are used to help to alleviate those symptoms for women, as well as associated diseases that come at that time, such as cardiovascular disease, osteoporosis, thyroid disease, all issues that can arise in the perimenopausal, menopausal time, and that many times menopausal women are looking to do things. They want to be proactive about their heart health and proactive about their bone health. So we really want to be able to give them good, herbal and lifestyle diet types of support there. And then lastly, in that time, chronic vulvovaginitis becomes quite an issue for many, many women. And there are a number of botanical medicines that can help to address that. And there are some just daily practices that can make women much, much more comfortable with those issues if that's the case. Then we'll be moving on to breast wellness and prevention. And looking at this, we're going to really focus on prevention and types of lifestyle things that we can do to help support the breast tissue and help to minimize risks towards the breast tissue. And then lastly, on this last slide, I just wanted to mention that it doesn't have to be a complicated thing, that many times we can do simple types of things in our daily, day-to-day regimes and lifestyle choices that can have a big impact. And this is just one example, that in current botanical research, there's a study done where it was a clinical placebo double-blind study where they looked at spearmint tea, just 2 cups a day, and found that women with PCOS drinking 2 cups a day within 30 days significantly lowered the levels of several hormones, including testosterone and free testosterone, and raised up other levels such as LH and FSH. And that, is a very simple kind of practice to add into one's daily lifestyle without a huge expense. So botanical medicine can be as simple as, a tea twice a day, and it can be, as complex as having a very single phytochemical isolated out and standardized and applied for a specific therapeutic need. So again, we're going to be looking at those kinds of things that women can use day to day to help to impact their health overall and their hormonal health.
Great, thank you, Mary. And I just want to add to Dr. Bove and I will be kind of exchanging places in some of these modules where she'll give her a break and we'll talk about some things, and she'll give me a break and she'll talk about some things. But one of the things we'll talk about in women's health, and I'm actually quite excited about this because we just got a study on breast cancer approved with just a whole slew of herbal medicines as part of the protocol at Ohio State University. So I'll have a lot to say there, and of course there's always a question of the isoflavones, which are known as phytoestrogens, and I'll be able to elucidate there, what's the truth? Is it safe? Can women with breast cancer use this, or with risk of other hormonal cancers? So we'll talk about that in depth and talk about how they operate and how they act. And, I think it'll be an excellent expose of women's health. And thanks to Dr. Bove.
And Dr. Spellman, can you explain the learning experience? Will there be case studies? Explain the weekend for our listeners.
Sure. So if we're on the Women's Health Weekend, Dr. Bove is, I believe, going to do some case studies. Did you mention that?
I didn't mention it, but I do have some case studies to present that not only present the application of botanical medicine towards the issues that in the case histories, but it also gives a good example of the different approaches that need to be taken in a whole kind of approach to endocrine dysfunction.
Right. Excellent. Great. And I'll be talking about some case studies in the peds as well, some stuff that I did in the clinic that actually worked well, and I think Dr. Bove will as well in the peds section. So yeah, there'll be case studies. We'll also, like I said, we'll also look at hardcore research and do some of the molecular biology, but hopefully relevant, so that you're not falling asleep. And and we'll deal with pertinent issues: how to use herbal medicine, how to apply them, how to prescribe them, thinking about posology or dosing. We'll always, in each one of these modules, we cover safety and the herb-drug interactions, and each herb that we talk about, we'll cover that as well. So it'll be very complete, I think, and something you can apply on Monday morning when you get back to your clinic.
Wonderful. Well, thank you so much. Actually, this is a perfect segue into our question and answer period. If you have a question for Dr. Bove and Dr. Spellman, please use your chat option. We do want to be mindful of our time tonight, so I will address a couple of the questions. Please note that we will respond to your answers via email after the webinar. I have a question, doctors. I am very interested in botanical medicine, but I'm very cautious surrounding the contraindications. Can you comment?
Well, sure. Dr. Bove, you want to start and I'll finish, or you want to go the other way?
Sure, I'll start. I think that, contraindications of herbal medicine are very specific to specific herbs. They can also be specific to more larger groups, such as herbs that contain certain phytochemicals or metabolites, such as alkaloids. We know, for instance, that alkaloids impact the nervous system. And so we will talk about contraindications as they come up with a specific herb. But as far as general contraindications, in the pediatrics one, we'll look at contraindications for age group, as well as for infants versus toddlers versus, more straight age children.
Excellent. And as I mentioned just a few minutes ago, every herb that we cover, we will do an herb-drug interaction section on, as well as a safety section on it. So Both Dr. Bove and I, depending on the module, both of us will be talking about safety and contraindications and appropriate therapeutic use. So nothing to worry about there, really.
Great. The next question is a pediatrics question. What do you recommend for nutritional testing and hormone testing, and at what age do you recommend this testing?
Dr. Bove, I'll let you take that.
All right. Well, certainly I think that, looking at testing would be dictated by the issue. And so if there were issues with, say, maturation in adolescence, and we needed to look at hormones, then certainly that would be, done, and I would do a standard serum testing for that. Generally, I don't think that there's an age cutoff, in the sense it's more the need and the relevance. If I find that those levels or that information from testing is going to help me either choose my herbs or have a better plan, or help me to reach an adequate therapeutic dose, then certainly I would be using testing in that sense. And generally I use standard testing and or functional testing. And sometimes with functional testing, I'm more looking at the function of the system rather than, a black and white, is it broken?
Great. Lindsay, any more questions?
Yeah, I believe this will be our last question. I use BHRT in my practice for both my male and female patients. Will you be covering natural therapies that complement BHRT?
Mary, I'm going to let you take that one.
What is BHRT? I just have to make sure that I'm getting the abbreviation right. I have dyslexia.
Sure, bioidentical hormone replacement therapy.
Okay, that's what I thought. I just wanted to make sure that.
You have to make sure it wasn't botanical hormone replacement therapy.
It's like, I'm hearing the letters and I can't always see them in my mind's eye. And the question was, will I be discussing herbal medicine that will
complement hormone replacement therapies?
Yes, I will.
Both men and women. Okay.
I will in the women's. I'm not sure if we're covering it in the men's, but certainly I would say that there are many herbal medicines that can be used complementary to that. And also there are herbal medicines that one might want to shy away from, and we'll also discuss that.
Yeah, and I'll just add, we will be covering some of that as well in the men's health, male health module.
Great. Is there any final comments from you, Dr. Bove and Dr. Spellman?
Mary?
I would just say that I welcome you all to come, and I'm a very enthusiastic teacher. I love my topic, and thank you for joining us this evening and letting us speak to you about passion of both of ours.
Thanks, Mary. And I would just top it off by saying Dr. Bove is really a fantastic teacher. People walk away starry-eyed and full of information and interest and enthusiasm about the practice of medicine, especially from the natural side. So we're really lucky to have her. And I would just say that this is a really unique opportunity. You've got we're filling these modules with just really the world's experts in botanical medicine and people that really have the know-how and understanding. And so you get both the evidence base as well as practical experience. And there's just nothing like this at this point. So, yeah, we welcome you and look forward to seeing you soon.
Great. Well, I would like to thank everyone for joining us tonight on this webinar, especially Dr. Spellman and Dr. Bove. I do appreciate your time. If you have any questions and you would like to register for these courses, please give us a call directly at 561-910-4960. Thank you so much and have a nice evening.
Thank you.